The Philips Digital Healthcare Conclave is a signature event of Philips, and every year we try and make it bigger and better. We learn from our lessons from previous years, make changes, and come back to you with newer insights. This year is no different. As I mentioned, we've got keynotes, panel discussions, showcases on the show floor, and masterclasses. So we're really looking forward to a very exciting day of exchange of knowledge. I would like to invite the head of Philips Innovation Campus Bangalore to welcome this August gathering, Ms. Kalavathi GB.
Again, thanks to all the audience, braving the traffic of Bangalore and being here on time. I think weather has been wonderful as compared to the earlier part of this week. The rain god has taken mercy on us. So once again, thanks to all the speakers, and thanks to all the Philips leaders who have traveled from all over the world to be part of this conclave. And with pride, I would like to start this 5th edition of Philips Digital Healthcare Conclave. And I think this is the right timing, especially looking at what is happening across the world and what is happening in India, and how some of the bright minds coming together here can influence how we can improve the access to healthcare. So just taking a step back, because it's extremely important for us to look at what is the problem that we are trying to solve, or what are the challenges that we have. I think many of you are very well aware of the statistics that 1 out of 3 people will get into having cancer in their lifetime. And if you look at diabetes, India is the capital of diabetes. I'm not proud to say that, but I have the opportunity to influence it. If you look at the respiratory diseases and the cardiac diseases, etc., I think it is growing. So here is an opportunity for us to see how we can circumvent these challenges through our technology and through the experience that we have. Moving forward, if you look at India, I think Sriram already mentioned the constraints that we are having. And there is a need for us to help the situation. If you get into numbers, we have 7 beds per 10,000 patients, whereas globally we have 38. If you look at the doctors, we have about 29, whereas the global average is 109. Of course, there's a big difference in what happens in the cities and also what happens in the rural areas. And if I look back to what we at Philips, what is our mission? It is about touching 3 billion lives by 2030. And here is a great opportunity for us to influence the healthcare, given these challenges. Now, moving on to what are the 6 trends. I'm sure many of you are aware. This is just for us to remember and see how we can channel our thoughts towards the solution. So, as you saw, we have resource constraints, and we have aging population in many of the countries. And there is a lot of focus on the population health. And I'm sure many of you are wearing your Fitbits and then the Apple Watches, right? Many of the consumers are trying to take control over the health and how they can be healthy, etc. And at the same time, if you look at the reimbursements, in fact, I was having dinner discussion with Yarun, and we were talking about what is really happening in the healthcare industry. If you look at reimbursements, many a times, until now, even in many countries, it is pay per service, right? If you look at the healthcare costs, it is growing much higher than the GDP. And if you look at some of the developed countries like the States or the North America, basically, the insurance is moving towards value-based care. That means it is about outcomes. You never get paid on the tests that you make, but you really look at what is the outcome and how are you influencing the wellness of the patient. That's how the world is moving. That being said, we debated about what works in North America is not going to work in the rest of the world. because the situation is very different, affordability is different, and there are many differences if you compare North America and India. However, we can all look at what is happening, and if there are best practices that we can learn from, and see how we can use the technology to influence the access of care. Moving forward, I think all of you know much better than I do that technology is going to rescue us. When you talk about AI, I'm sure that many of you who are sitting here are going to come up with umpteen ideas. In all these things, data plays a very, very important role, because that is going to tell us whether we are moving in the right direction. That is going to help us to personalize our ideas to make a difference to the patient. So in the master classes and then also in the next sessions, many of them are going to share with you what we at Philips are doing from an AI perspective, and how the technology is allowing us to move from organ-based imaging or the analysis to getting into genomics and getting into precision diagnosis, helping the providers to be confident about the diagnosis and making it faster. So AI is helping us in multiple ways, and also you can talk about many other technologies like VR, etc., which is going to help our journey. However, if you look at the data, there is an overload of data. And whatever we are doing is minuscule right now. So the positive point of it is it provides us great opportunity to accelerate our efforts, especially using the technology to make a difference. So now, again, moving back to some of the things that we do at Philips. So we conduct a future healthcare index survey. This is done in about 15 countries. And India is one of them. If you look at the survey results, India is in the forefront when it comes to usage of digital technologies within healthcare. So this survey is all around the digital healthcare, so India is in the forefront. 75% of the professionals who gave this survey, they use the digital healthcare technology, and they're asking for more. Out of this, 46% have gone ahead in using the AI technology. And that is going to make a difference, surely. If you look at, as I said, many of us wear wearables because we care about how are we doing on a daily basis. And some of you would have given the survey. 64% of the people who gave the survey felt that they are in control of their health, and it is helping them. And whenever they are in control of their health, it helps their overall experience when they go to the providers. And finally, 67% are saying that they are comfortable not going to the physician, but talking to them over the phone and getting the advice. And this paves the path for telehealth. I think given the population, given the constraints that we have in India, the telehealth is going to take a center stage. And if you want to increase the access to care, I think this is something that we have to work on, so that we can provide the same kind of care to people who are in rural areas. So you're going to hear much more about this as the day progresses. Now, apart from this, apart from all of us, I think India is taking a great interest in increasing the access to care. If you look at Ayushman Bharat efforts, it's very timely. They are setting up infrastructure which is going to help with the access to care. And very recently, even Sriram talked about the National Digital Health Blueprint. It's an action for realizing the capability of digital technologies to provide seamless care and then increase the access. So I'm very happy to share with you that some of my colleagues have been part of this journey, and using the experience that we have, we are trying to influence the policy. And I'm sure that many of you who are present here are aware of this and also giving your thoughts in order to make a difference to India. And again, if you get into details, this is actually looking at some of the global trends and looking at what is reality for us. How can we leverage some of the good things which are happening, and how can we get the ecosystem together? It's no more about systems. It is about the connect with ecosystems. And then how can we make it interoperable? Because if you have to leverage digitization, it is extremely important that the data should be structured. You have to curate the data, and then also make use of the data to help us. And again, you're going to hear Jeroen talk about this much, much more as we go forward. So with that, I'm sure that all of you have looked at this. At Philips, we care about the people's life journey. It's not just about being reactive. It is about using our experience, both in clinical, technology, and also in the consumer space, and helping them to have a healthy life. And also helping with prevention. And see when something happens, we have precise diagnosis to provide personalized treatment and help the transition from hospital to home and make them recover, and the cycle continues. And we have portfolio of solutions which is going to look at the patient at the center. And not only that, through this journey, it is extremely important that we look at the quadruple aim. That means, how are you going to make the experience of the patient get better? Because especially when we are ailing, it is very important to feel good at that time. And at the same time, how do you improve the experience of the staff? And also, how do you focus on outcome? And finally, how can you make it affordable? So this is the journey that we are taking at Philips. And if you look at what we do, we take every opportunity to bring the providers, the ventures, the universities together in order to have fresh thoughts to see how we can move towards value-based care. And also, how we can use the AI, VR, all the technologies to make it relevant to each of the countries. And also, it is not just about redoing everything. It is about building platforms. It is about making things modular so that you can provide the right solution to people. And through this journey, we co-create, because what works somewhere is not going to work in India. So how can we leverage each other in order to co-create and come up with the solution which is relevant to us? So that is the focus here. And finally, if we have to meet the mission of Philips of touching 3 billion lives, I think India is a very, very important place. And that is the reason why we have all these global leaders and all of you smart people coming together to exchange the insights and see if we have any breakthroughs which can influence our living here. Overall, I don't want to take too much of time because we have interesting topics which is going to come in further. So it is all about quality. How can we focus on providing quality healthcare? And this is the right time, and let us join hands to accelerate this. Thank you very much.